I started looking into GLP-1 agonists for myself, to be quite honest with you. It wasn't about weight or weight loss or diabetes. It was a couple things. One is I have psoriatic arthritis, and sometimes it can be incredibly painful. And in fact, I've seen data showing that psoriatic arthritis is actually more painful than rheumatoid arthritis. And I used to have a joke. My background's in musculoskeletal medicine, and particularly the immune components around it and regenerative injection therapies. So I know a lot about these conditions. And I used to have a joke that I would, if I were to curse my enemy, I would curse them with rheumatoid arthritis. But I got to say, I think I might curse them with psoriatic arthritis. So I've been looking into it for the autoimmune impacts it has, and then particularly pain, central sensitized pain, pain that starts in the brain. Oh, well, all pain starts in the brain, but there's a phenomenon called central sensitization. I've done podcasts on this in the past. I've talked about it on different episodes, and it's this idea of centrally sensitized pain. It's a pretty horrific way to live, and I've been living with it for decades. And if there's something that can turn it down, I'm all for it, because there's really not much that can turn that down. So anyway, got looking into it for those reasons. And then for the cognition benefits and the fact that it's anti-inflammatory in the brain, that was very intriguing to me. And I wanted to look deeper. So I did, and I was blown away. And then I found a ton more literature. And no, it's not all sponsored by big pharma. I've been getting a lot of ignorant comments back from people saying, oh, all the studies are sponsored by big pharma. That is not true. And companies have to do longitudinal studies on their products for the most part to get FDA approval. Once they're approved, and that it's questionable how long some of those studies last, because I'll be honest with you, some of those studies did not last long for a lot of other drugs. But there have been some really great studies done on this drug that were sponsored by big pharma. And I understand that not everybody's down with big pharma. I am not a huge fan myself, but let's not throw the baby out with the bathwater. It's really an ignorant stance to say, well, I feel like we've been scammed these past few years, so therefore it's all bad. That's just not a great stance to take. You might need big pharma someday to save your life. And we're grateful that some of these pharmaceuticals exist. So that's my stance. I'm all for using the tools that we have available to us. Puppy and Sansa are getting along beautifully, by the way, if you heard that growl in the background. But Sansa lets him know. She lets him know what's up. Anyway, all that to say is I'm not opposed. Oh, here he is. Come here. Come here. Oh, if you're watching on YouTube right now, you can see him. He's such a cute floofer. But man, he chews on that. He chews on Sansa. He chews on her. He chews on everybody, huh? Yeah. We don't have a name yet. He's very cute. Sweet dog. Anyway, all that to say is I'm not opposed to using pharmaceuticals when necessary. Never have been, never will be. One of the reasons I became a naturopathic physician in the state of Oregon is because I can prescribe, and you cannot take patients off of pharmaceuticals unless you can prescribe them. If you don't have a license to prescribe, you can't tell someone to stop taking their drug that they're on, that their other doctor put them on. So for all you health coaches and nutritional therapists listening out there, I hear constantly from people saying, oh, my health coach told me to stop taking my thyroid or whatever it may be. That's illegal. Can't do that. Unless you have a license to prescribe it, you cannot suggest a patient discontinue it. But I am all for using pharmaceuticals when necessary. The goal being is my motto. We use the lowest dose necessary while we continue to improve the health parameters of the patient. So we can either discontinue the medication, cycle the medication, or use the lowest dose necessary. That's how I do medicine. If you don't like it, that's okay. People are screaming at me saying, oh, you've sold out to big pharma. Oh, contrary. You guys just don't know how I practice or how I used to practice. And I have absolutely no problem with using pharmaceuticals when necessary. So for all you purists out there, fine. That's fine if you're unhappy with me, but this is how I've always been. And you've been following me all this time. So it is what it is. I also think there's a lot of purists out there that hate on any kind of pharmaceutical because they think they have the solution in a natural form. And I'm sorry, but sometimes we need a drug. And if we have something available to us, like bioidentical hormone replacement or peptides, why not use them? Like, why not feel better? So all that to say, and I'm going to get into it here, this stuff is being dosed wrong in many cases, and it's being dosed too high and too aggressively and for too long. And while I can't discuss specifics around dosing, I am going to talk to you about my thoughts on that. But let's just stop for a minute and realize there's a lot of times that medications save lives. And damn if I'm not grateful for prednisone and antibiotics when needed, right? It's crazy the vilification I've seen around semaglutide and tirzepatide. So the difference, once again, because for some reason it keeps getting missed and I keep getting asked this, and I don't know if people aren't listening to the episodes or they're just not hearing it. Semaglutide and tirzepatide are two separate peptides. Semaglutide is a GLP-1 agonist. Tirzepatide is a GLP-1 agonist and a GIP-1 agonist. They do different things. They do similar things. The way I understand it is that tirzepatide essentially has a fat burning effect, a direct fat burning effect, while semaglutide more specifically is just working on the GLP-1 receptor. We have GLP-1 receptors all over our body. They're in our brain. They're all over our body. We produce GLP-1 naturally in our intestines. As people age, their intestines atrophy. They lose things like intrinsic factor. That's a molecule made by the stomach lining. And as the stomach atrophies, we lose intrinsic factor. Intrinsic factor is necessary for the absorption of B12 from our food. So it is my firm belief that as folks age, they should start getting B12 shots. We also lose the ability to secrete some other things from some of our other cells as our lining atrophies, as our intestinal lining atrophies. If you're talking to a purist who's never dealt with inflammatory bowel disease, I'm talking ulcerative colitis or Crohn's, they have no idea that sometimes we lose the ability to secrete some things because our intestines have been so damaged. If you've had longstanding IBS and severe bacterial overgrowth and parasites and dysbiosis and leaky gut, you may have lost some of the ability to secrete your GLP-1 naturally. There's a lot to unpack around this, and I can't do it all in this episode, but the point is, some folks, including we have data to show that diabetics, type 2 diabetics, and those in the obese category definitely have been shown to have GLP-1 deficiencies. So when people go, nobody has an Ozempic deficiency, au contraire, actually some people do have a deficiency. So let's be kind and not judge others for the pharmaceuticals they choose to use or not use. I have a theory about this. I think it's kind of the crabs in the bucket thing. People don't like watching other people win. So as some folks are getting healthier and enjoying all of the benefits of the GLP-1 agonist they're on, not just the weight loss, but all of the other benefits, their skin improves, their hair improves, their hormones improve, their brain and cognition improves, their depression lifts. Some of these wonderful side effects that you're hearing about are actually direct actions of GLP-1 agonists on different organ systems in the body. Go back and listen to my last 2 episodes to hear all about it. People hate on them. Nobody likes to see somebody winning. It's the truth. Humans are weird that way. If somebody's winning, the crabs in the bucket. If you guys don't know that story, it goes like this. If you put a bunch of crabs in a bucket, you never have to put a lid on the bucket. Why? Because if one crab starts to climb out or attempt to climb out, the other crabs will grab him and pull him down. So I'm seeing a whole lot of that. And granted, there are people out there, and we're going to talk about the different types of patients and how I would categorize them around this peptide. But there are people out there getting hammered with this stuff at high doses and they're wasting away and they're not doing it right. And they want to blame the drug. They want to blame the doctor. Sure, go ahead. But let's also look at the person. Are they actually hitting their protein macros? Are they lifting weights? Are they doing all the things? I talk about all this at length in the other episodes, so I won't get into it too much. But point being, it's not being done right. That's why this series of podcasts is called Ozempic Done Right, because I believe there's a better way to do this.